is asking, when is it necessary to treat endometriosis on the bowel? What is the likelihood of needing a colostomy bag? That's a very good question, Malgorzata. When is it necessary to treat endometriosis in the bowel? I'm assuming you're talking about endometriosis that is invading into the bowel, going inside the muscle of the bowel. It very much depends on symptoms. My approach is, well, except for one or two situations, if the nodule is big enough to cause obstruction or intermittent obstruction, then our hands are tied and it really needs to come out, and that's always in that scenario by a segmental bowel resection. But in other situations, I would be guided by the patient's symptoms. And when I say symptoms, I don't necessarily mean bowel symptoms, because it's possible that you have a nodule inside the bowel that does not give you significant gastrointestinal symptoms. But my philosophy in surgery is that you will be guided by the patient, by their symptoms, by what they go through. What is the possibility of needing a colostomy bag? Well, in my practice, it's uncommon, less than 5% at the moment. We looked at this data recently. We only use an ileostomy or a colostomy bag if the joint, if where we put the two ends of the bowel together is particularly low. Some authors have said 5 centimeters. In my opinion, it can even be less than 5 centimeters, and you can get away without an ileostomy bag. But it depends on many different factors. Our default is not to put an ileostomy unless something is unusual, unless we're not happy with the joint or it's particularly low. So, but we always tell our patients that this is a possibility, and they will go to theatres with that in mind.